Hello, I'm Jessica Aubert and I am the Women's Health Physical Therapist at Bay Area Medical Center. I have worked at Bay Area Medical Center since 2006 and I took my additional training to treat pelvic floor disorders or problems more common to women such as urinary incontinence in the fall of 2006. What you can expect at a physical therapy evaluation for incontinence is a very thorough 90-minute examination the first day. Also, prior to that first day, I do mail you a packet of information that asks some questions just about how your bladder and bowels are working, how long it's been a problem, what things seem to aggravate or potentially alleviate it, and it includes a 2-day log where you track what you're eating and drinking, what times you're going to the bathroom, and when leakage is occurring, both times of day and what might be causing it. That just helps me to put together all the pieces from the history. Then after reviewing that packet with you and going through some other general history questions, we proceed on to the actual examination. And that first includes a screen of your lower back and your hips, just to make sure none of the muscles in those areas are contributed to the problem with your pelvic floor muscles. But our main focus of the day is the pelvic floor muscles. If you've ever had physical therapy before, you know that we're muscle and bone people and how those areas work together. And the pelvic floor muscles are muscles just like anywhere else in your body, like the muscles of your legs and arms. We call those skeletal muscles. They help you with movement. And so this pelvis shows you where those muscles are. This would be where your spine comes up here. This is the sockets for the hip, and the pelvis makes a ring. At the bottom of that ring, if I just tilt this pelvis like the model is lying on their back, you can see a bunch of pinkish orange color, and that is all the pelvic floor muscles. The pelvic floor muscles are divided into 2 layers. There's a layer that's just underneath the skin, which is visible, and then if I tilt the model the other way, there are muscles that are deeper inside the pelvis. So my examination of these muscles includes, with your consent, feeling the muscles through the skin to make sure that there's not an area of spasm, or if you've previously had like an episiotomy or tearing with a birth, if there's scar tissue, how that tissue is moving. And then I do also do a vaginal assessment, and that lets me know what these deeper muscles are doing because they cannot be felt from the skin level. And when I do that, if you've ever heard of a Kegel contraction, that's what I'm testing. I want to know how tight your Kegel squeezes around my finger and how long you can hold that for, and how many repetitions of that contraction you can do to get an idea of strength and endurance of the pelvic floor muscles. I do also palpate or feel all of the muscles on that deeper layer vaginally as well. If you're having any trouble with fecal or incontinence of stool, then sometimes we also do a rectal exam, which is very similar to the vaginal exam, just done rectally. And once we have all that information, then I can put together a program to help strengthen your muscles, help stretch or relax your muscles. And then with that bladder diary, we can look at your voiding and see if we need to do any treatment for that. Women's Health Physical Therapy is a subspecialty of physical therapy where we focus on conditions that are more common to women, and that can be anything throughout the female lifespan. So for example, in the teenage years to early adulthood, when women are more active and their bodies are changing because they're still growing, they are more prone to ACL injuries of the knee. So it can start with common orthopedic things that people think of when they think about physical therapy, but then it can get into more specialized things for women like urinary and fecal incontinence, pelvic pain, and pelvic pain can be from a wide variety of reasons. That can be pain during or after pregnancy. It can be from conditions that are common to women like endometriosis that can lead to scarring. It can be after a pelvic surgery. There's many things that can cause pelvic pain. And then also lymphedema, which is not just something that happens to women, but can happen after breast cancer. It is typically from cancer treatment, whether radiation, chemo, or actually having to have lymph nodes removed, and that causes swelling in an arm or leg depending on where those lymph nodes are located. So that's another thing that a women's health physical therapist could treat. A lot of women, anywhere from 40 to 80%, the research is a little mixed depending on which article you read, do Kegels incorrectly. And so physical therapy can be very helpful to just teach you how to do those exercises in the right way and how many you should do. A lot of times if you read a popular magazine or something, it might say, oh, you should squeeze your pelvic floor muscles in order to make them stronger, but they don't tell you how long should you squeeze them for, how many should you do you need to do them every day? So we're here to help clarify all that information for you. A Kegel is just a fancy name for a contraction of the pelvic floor muscles. So the physician who discovered that we have voluntary control of the pelvic floor, his last name was Kegel, and so that's how they got that name. But all it is a contraction of the pelvic floor muscles that we control. Biofeedback is a really awesome tool that we have in physical therapy that's very helpful. Because so many women do their Kegels or pelvic floor contractions incorrectly, biofeedback allows us to see your pelvic floor contractions. So these muscles, because they're small, remember from the model, they can be hard to feel. And because of that, and we also can't see them moving traditionally when you do a Kegel, there's not really anything that moves that's visible from the outside world unless you're literally looking at your perineum. So the biofeedback allows you to see what you're doing to get a better Kegel, whether it's for strength to get a better contraction, or if you're having difficulty relaxing, which is altering how you void, then it can help you learn how to relax those muscles better. So I have on my computer here a sample of the biofeedback. And we can set it up as one screen or two screens. So this is right now showing two screens. The top is a internal vaginal sensor. It's just a plastic applicator that gets inserted like a tampon, plugs into this little box here, and grafts when you're doing your Kegels. The bottom contraction is surface electrodes, which just means they go on the skin, sort of like if you've ever had an EKG, and that is hooked up to the abdominal muscles. Sometimes people try to substitute their pelvic floor contraction with other muscles, so that second set of sensors can be used in those instances. I would say the majority of the time we use just the single vaginal electrode and only have one screen. Otherwise it can get to be a lot to look at. But this can be set up for any timing that we need. So right now this is set up to work for a few seconds and then rest for about double the time, and it's going through a bunch of repetitions. But we can set that for as many as we want. And basically it's a real-time look at what your muscles are doing. And then I can set goals on it. So you can see this first one's kind of low, the next one's a little higher, and then by the time we get to the next contraction, it's a little higher again. So obviously this was not a full effort, so I can put goals on the screen so you can try and hit those goals, kind of like playing a video game or something. And then it also helps us to track your progress from week to week, because let's face it, nobody loves having a vaginal exam performed, and that's otherwise the only way for me to know how your muscles are working. So this allows you feedback so you can do better Kegels when you're doing your home exercise program, and also lets me to see how you are progressing so we can advance your exercises as we need to work towards those goals that we have for therapy. E-stim is another treatment modality that we use, sort of like the biofeedback, and it's more for people who are having trouble doing a pelvic floor contraction on their own. So maybe there's been some sort of nerve injury, either from a delivery or some sort of surgery, or just maybe something in their back going on where the nerves aren't working the way they're supposed to. And so it's a way for us to re-educate the muscles through an electrical impulse. Basically, all of our muscles are controlled by nerves, and our nerves speak to our muscles via an electrical signal. So the biofeedback was using that electricity to form a graph of what the muscles are doing. E-stim, or electrical stimulation, is giving an electrical signal to your muscle to make it function. So that's not something we use a ton in physical therapy, but it is a tool that is available for people that can't do their Kegels maybe in the traditional way by themselves and they need a little extra support. It uses that same vaginal electrode, which was just the plastic applicator, sort of like a tampon. It plugs into a very small machine and then just gives a stimulus to the muscle. and can help them get a better Kegel. Bladder retraining is a program that we do based on that void log that's filled out in the welcome packet, or maybe at a future session if that wasn't done before the first treatment. Basically, we know what the normal habits are for the bladder. We know how often you should be voiding in a day, which is 6 to 8 times, or every 3 to 4 hours. And so if you are voiding more often, or not often enough, but traditionally it's more often than that, then we look at your dietary habits, both fluid and the foods you eat, because certain things can irritate the bladder. I'm sure everybody knows about caffeine, but there's actually a whole list of items, acidic foods, artificial sweetener, things like that that can bother the bladder and make it want to empty more frequently. Sometimes our bladder muscle also can just be trained to void more frequently, and that is often because of our own habits, such as just in case peeing, which is when, oh, I'm going to go to the store, I don't really feel like I have to go, but I'm going to go because I don't want to go when I'm at the store. And if we are often emptying our bladder before it was actually full, that trains it to not hold as much urine, and that will make us go more often. So bladder retraining can include timed voiding, which is where we put your bladder on a schedule to gradually draw out the time in between until you get to that normal 3 to 4 hour range. And also includes a lot of patient education to know about the items that do irritate the bladder that we consume, or just the general habits that we have that can make the bladder not function in the way we would like it to. It also includes education on good bowel health, even if the bowels have nothing to do with the reason that you're there, if your leakage is all urinary. Chronic constipation leads to pelvic floor weakness from the constant bearing down to pass stool. And also, if someone is constipated, the stool is taking up more room in the pelvis. And again, this is not a lot of real estate in here and has to fit a bladder that holds about 2 cups of urine, potentially the uterus if that is still present, and then the rectum with stool. So if there's a lot of stool sitting in the back of the rectum, it can push into the bladder and make the bladder more urgent. So there's also education on good bowel health and keeping the stool regular, fiber, things like that. Urinary incontinence just means that there is leakage of urine. So there are different types of urinary incontinence. Stress incontinence means that there is some sort of pressure on the bladder, typically from the abdomen, that leads to leakage. So that's the leakage you think of when you cough or sneeze or laugh or do something physical. And there's also urge incontinence, or just urgency. So urge incontinence is when there is a sudden strong contraction of the bladder that makes us feel like we have to void, and it's uncontrollable, so the leakage happens. Or urgency on itself without incontinence is just that strong, uncontrollable need to go to the bathroom often, but you are able to make it in time and don't have leakage on the way. And then the other more common type of incontinence is mixed, and that's just a combination of any of the types, most commonly stress and urge. How physical therapy can help treat incontinence is if there is a problem with the pelvic floor muscles. So again, all of these muscles and the 2 main layers that are just underneath the skin and the deeper layer that directly supports the bladder, uterus, and rectum are called skeletal muscles, which means we have complete voluntary control of them. So they can be strengthened with exercises. So after that evaluation, if we find weakness in those muscles, then we can prescribe an exercise program in order to help those muscles get stronger or have better endurance, or maybe better coordination if they're just not working at the appropriate time, such as with stress incontinence. Often the leakage is with coughing, sneezing, laughing, or physical activity. Maybe the muscles just aren't squeezing when you cough or sneeze, and we have to retrain them to do that. And these muscles also are, well, they're small. I mean, this is a pretty typical adult-sized pelvis, and so compared to the big muscles of your legs, these muscles are not very large, and they're also kind of hidden, and they're in an area of the body that we often don't want to talk about because it's a very private area. Incontinence can be caused by a variety of reasons, and that's why a good physical examination is important, not only by a physical therapist, but also by your physician, whether that's your family provider that does your pelvic exam, or an OBGYN, or even a urologist. And the common causes are weakness in the pelvic floor would be a reason that physical therapy treats it. It can be from the bladder, uterus, or rectum falling in the pelvis, or what's known as a prolapse, from ligaments not supporting the way they're supposed to, or the muscles not supporting, and that's typically from some sort of trauma from childbirth or chronic constipation, again from all that bearing down. Maybe someone who has a very physical job that's doing a lot of heavy lifting, and that constant increase in abdominal pressure can lead to the stress incontinence happening. But typically it's from some sort of injury, or another thing special to the female lifespan is hormones. And so sometimes the change in hormones, like with menopause, with a drop in estrogen, the tissue is not as elastic, and that can also lead to incontinence. I think the main thing to remember is, irregardless of the cause, sometimes it's felt that incontinence is just a normal part of aging for women, and that's not true. There's definitely parts of the aging process or things that happen in a woman's life that make you more likely to become incontinent, but it's very treatable. Physical therapy is just one of the treatment options. Someone would know if they would benefit from physical therapy to treat their incontinence by, one, just talk to your doctor about it. But if you are having leakage that you cannot control and that's bothersome to you, then likely you would benefit from some sort of treatment. And physical therapy is definitely one of the things on the conservative realm of treatments that should be tried in the beginning of the process to get rid of the leakage, sort of like medications, things that you would try before you went to something like a surgery. But the main thing is to make sure other things are ruled out. A bladder infection, for example, can lead to urinary incontinence, and that's definitely something that physical therapy is not going to help with. That just takes an antibiotic. So the most important thing is to talk to your doctor about your leakage so that they can direct you on the correct path of treatment so that you don't have to live with it.